the Barbara L. Posner Wellness and Support Center. And we are really excited to be on our last day of Survivorship Week. It's been a great week with many events that have all been virtual, so they're all recorded, and we're going to have them on our website and other social media areas so that everyone can look at them again. And today we're really happy to have more of our Rehabilitation Services Department talking to us about the different ways that occupational therapy and speech therapy can help with common symptoms, side effects, problems that patients find after their cancer treatment, and again, ways that can be helpful. So let me let you all start and introduce yourselves, and welcome. Thank you very much.
So my name is Katie. I'm the occupational therapist over here at the Rehab Center, and we have our speech therapists over here too. They'll introduce themselves when it's their turn. So I'm going to talk to you guys about what OT can do for our cancer population. So, you guys ready? Okay. All right. So one of the main things that we find is challenging with our cancer population is fatigue. So fatigue management, a lot of patients tend to be kind of tired after chemo, it kind of wipes them out. So one of the things that we can offer are teaching ways to conserve your energy. So whether that be kind of breaking up your tasks throughout the day, having seated rest breaks, working on breathing techniques. There's lots of different ways to conserve your energy so you're not so fatigued and wiped out after your chemotherapy. And then we also talk about ways to improve your endurance. So because of that, being able to stand for long periods of time, stand for your showers, stand in the kitchen and kind of do all your day-to-day stuff can be a little challenging. So we work on some standing tolerance exercises and ways to kind of build that back up. So you can get back to doing all your day-to-day stuff in the house and out in the community. And then we also work on strengthening. So a lot of patients might have some weakness in the shoulders. They might have trouble kind of washing their hair or reaching into cabinets, kind of doing any overhead lifting. So we can work on giving them a upper extremity exercise program to kind of strengthen up the arms. And that also kind of helps with fatigue too, because a lot of patients get really tired reaching overhead. And then we also do a lot of stuff about home safety. So some patients might need some equipment, whether it be like a shower chair, wheelchair, walker. Sometimes patients need a potty chair. So we can kind of recommend different pieces of equipment. Our PowerPoint just went out. Where'd it go? Sorry. Okay. So we can recommend different pieces of equipment that might be appropriate for the patient to kind of help get them a little bit more independent. And then we also do a lot of caregiver training. So the caregiver might need to learn different ways to transfer the patient if they're having trouble walking, or ways to kind of safely guard them as they're moving around the house. We'll teach them how to use the equipment, whatever we recommend. And there's lots of different strategies for that as well.
Can I interrupt with that? Because that's amazing. I didn't know that there was caregiver training. Can you talk a little bit more about that? How in the world is that covered? How do you, oh my gosh, that's blowing my mind.
So caregiver burden is a pretty big thing, especially if you're, if the patient who has cancer is having a hard time doing their day-to-day stuff, the caregiver has to help out a lot. So we kind of teach them ways to make life a little bit easier. We go over ways to prevent bed sores. So if the patient, isn't able to be mobile, we teach them about pressure relief and different things that you can put in the bed, pillows, wedges, stuff like that. A lot of patients and family members don't really know about that kind of stuff.
Right. Is there a full referral for caregiver training, or are they just trained under the patient's referral and when you're seeing that patient?
Yeah, so it's kind of just a general OT eval and treat. So we can kind of address any needs that they're having. And a lot of times we have family come to the sessions with us and we educate them while we're educating the patient and making sure everybody's on the same page and that they're a cohesive unit. So what else can we do? We also do optimizing your first floor setup. So some patients might have a hard time going up and down the stairs. So we can talk to them about ways to kind of readjust their living room so they can have a hospital bed and a potty chair, and moving all the throw rugs and stuff off the ground so they don't trip. A lot of fall prevention.
While I'm being so interruptive, do you help to organize a home evaluation?
So if they're coming to us for outpatient, typically normally the home evaluation would be separate and first. A lot of times if patients are admitted in the hospital and then go home, they'll get their home therapy. If I feel like they need a home safety evaluation, we can help facilitate that.
Good. That's what my question was. Okay, great.
Yeah.
All right.
So,
Wow. Thank you. Okay, please keep going. I'm sure to interrupt again.
no, it's okay. But yeah, fall prevention is just really big because a lot of cancer patients, if they have any issues with bone integrity, like necrosis, or they might be really prone to fractures. So making sure that they don't fall is really important. So teaching them about like the non-skid mats in the shower, inside the shower, wearing the grippy socks, that kind of stuff. So we work with that. And then we can also do balance exercises too. I know PT does a little bit more of that, but if they only have OT, we can kind of address functional balance as well. And then the next section that we also talk about is your IADL. So that's, cooking, cleaning, shopping out in the community. We help patients kind of get back to those roles and routines. A lot of times when you're going through cancer treatment, your roles and routines might be a little different. You might not be able to go to work and, do all stuff out in the community if you're a part of like different social groups and stuff. So kind of reestablishing those roles and routines is something that we can help with. A lot of things that, during their chemo and cancer treatment, their medications might be changing a lot. So we can also help with medication management, kind of keeping track of all the medications and helping them organize. Sometimes we might recommend like certain pill boxes have like timers, and there's lots of cool equipment out there for medication. Some patients have trouble with that. And same thing with managing appointments. So a lot of times they have a lot of doctor's appointments and a lot of, visits that they have to do. So sometimes that can be a little challenging, kind of managing their calendar and their schedule. So we can help make that a little easier. And then, re-entering back in the community. So once they're feeling better and they feel like they can kind of resume, stuff out in the community, like going to the gym or doing yoga or, I don't know, going back out to the grocery store, we can kind of help get them ready for return to the community. Let's see what else. And then the other thing that we also do, some patients with cancer tend to have neuropathies and issues with sensation. So we can do sensory integration therapy with them. Basically, if they're hypersensitive or they're numb, we can try to help kind of make that back to normal. We have a lot of different techniques for that. And then, do you have any questions on that? Okay, that's pretty cool. And then the other big piece of going through chemotherapy and going through cancer treatment is the mental health aspect of that, which can be really impactful. So, stress management, being able to cope with, the diagnosis or kind of the whole process can be a little overwhelming. So we can help with showing them different management techniques to kind of not be so anxious and calm down. And then sleep is also a big thing too. So a lot of times if you're not feeling well or you're sick, your sleep patterns might be off. And if you don't get good sleep, then you can't regenerate and kind of, heal. So we can go over different ways to promote sleep hygiene so they can get a good night's sleep. And then functional cognition is also another one. Speech therapy is going to talk a little bit more about cognition. But chemo brain is a big thing. A lot of people are a little foggy. Their memory might be not so good. So we work on the functional aspect of that. So, if they're not remembering to take their medications or they're not able to remember different steps of cooking, we can kind of go through and kind of see where that functional piece is and address those concerns. So those are the main points.
No, they're great. Thank you. You asked if I had question with the neuropathy, neuropathy management, sensory integration. OT did talk a little bit about that because, a big unfortunate side effect of treatment can be chemotherapy-induced peripheral neuropathy. And there are medications to work with that. There's acupuncture to work with that. But we're excited to know that the rehabilitation services have ways too. And so being an integrative cancer center and trying to work in that complementary, integrative, holistic way. We're really excited to be able to be informed that the rehabilitation services can do so much as well. And it might take all of those things together to give the best results. So our message, and you're really giving that to us well, that we need to let the patients know that all of these things, it's a lot of work, but it really can make a huge impact in the overall healing and such.
Yeah, we can really address any concerns that they're having functionally. So whether it be bathing, grooming, dressing, stuff around the house, strength, balance, coordination, mental health, we really can cover a wide spectrum of things. So
That's great. Yeah, no, I just
one-stop shop.
give a plug again for rehabilitation services, really adding to the whole spectrum of our integrative care, because we talk about sleep hygiene, but if you talk about it more and what is sleep hygiene and what are the different tools and tips for that, I think it's great. So thank you very much. I'll be excited to hear more.
Absolutely. So I'm going to hand it over to the speech team.
And I want to offer that anyone on with us, please type in some questions, or we'll make sure we have an opportunity for you to ask questions as well. Hi, ladies.
Hello. Hi. So I'm Melissa Aris. I'm one of our speech pathologists that works pretty often in our outpatient office. And this is my coworker.
I'm Angie Ferreira, and I'm the other speech therapist that works here and in the hospital as well.
So let me see if I can click back into this and change our slide here. So as speech pathologists, we often sort of say we're the therapist for the neck up. So we do more than just speech therapy. Sometimes I feel like our name doesn't really give a good description of all the things that we can offer and address. So we're just going to kind of go through each of these little bullet points, and we're happy to answer questions if anybody has any along the way. So one of the big things that we work with in collaboration with the doctors and the dietitians is to kind of target good oral nutrition for patients undergoing treatment. And oftentimes this is related to patients that are going through head and neck cancer treatment. So one of the things that we like to do is be a part of the team to talk about maybe some exercises that patients can do even before they begin treatment to really optimize their swallowing function and to try to maintain oral nutrition as much as possible during treatment, but also to encourage resuming oral nutrition after treatment, even if a patient requires some supplemental nutrition, like through a feeding tube or something like that during the course of treatment. And we call that pharyngicides. It's actually a program of exercises that has been well researched, and it's kind of becoming the new standard of care for patients that are going through head and neck cancer treatment. So we're able to help offer those exercises at any point during the patient's course of treatment when we get added to the treatment team.
We also like to approach swallowing as it's a journey from the beginning to post-treatment, because we know post-treatment for cancer, particularly in the realm of head and neck cancer, that there are changes that occur down the road, and that having the tools and the techniques and the exercises to do post-treatment for sort of a lifetime allows these patients to optimize nutrition and management throughout the whole journey.
And obviously a big part of that's also addressing safety. But oftentimes it's more looking at efficiency too. If it takes you an hour to eat a meal, that's really losing some of its luster. It doesn't make it as an enjoyable experience as we want that to be. So we also look at efficiency, not just safety with oral intake. And then I think one of the things that a lot of patients experience as a result of medication side effects is something called xerostomia, which is dry mouth. And that can really also negatively impact your quality of life and in your enjoyment with eating and drinking. And that's not just specific to patients with head and neck cancer. So we have strategies for helping manage that throughout the day, especially at night, when maybe it is sort of negatively impacting sleep and things like that. So
sometimes it can even impact just the way they're communicating in a group setting. That dry mouth can really impact how they feel when they're talking. And so having some of those strategies or home remedies, we call them, to try to kind of really manage that is sometimes really helpful for patients.
And ultimately, we can make recommendations for maybe changing diet consistencies or textures of foods and drinks that people are eating and drinking during treatment or beyond to help, again, maximize their safety, but also enjoyment and efficiency with eating and drinking. So That's kind of our little plug for swallowing therapy.
So we also deal with speech depending on the diagnosis. There is sometimes implications to a patient's speech based on surgical interventions they may have that may have occurred, and or just some changes from radiation and chemotherapy. So we can work on exercises for strength and range of motion to improve speech clarity, compensatory strategies to deal with any changes to intelligibility, and then therapeutic ways to approach the conversational setting to maximize their ability to interact in that social setting.
And so I know Katie kind of said we were going to talk a little bit more about cognition. So we offer a pretty holistic approach to cognitive deficits. And when we say cognition, we kind of use that as an umbrella term to talk about all of those like brain functions that you need to be able to use to do your day-to-day function. So memory, attention, problem solving, reasoning, and organizing information in a way that makes you able to do your job and to do things around the house and engage in the community. So we have a variety of standardized assessments that we can use, which I think are really helpful because they give us the ability to compare your performance to people of a similar age. Because a lot of our patients will say, well, is this just because I'm getting older? And sometimes I think that's really hard to delineate or figure out without really looking at a comparison of people of a similar age. And that's one of the benefits, I think, of standardized assessment, is we really have a better way to tell you if it is just normal aging or if there's something else going on.
I think, yeah, I was going to say, I think one of the things that we hear a lot is I'm able to do what I was doing before, but my efficiency of doing it, because it just takes me longer to think through how I'm going to approach things, or just really that organization component of how am I approaching things, and that breaking tasks or breaking down lists of things that need to be done into a workable situation. I think that that's sometimes some of the things that we really hear are difficult for patients that are experiencing that term that we call chemo brain.
And I think the other thing to highlight too is that it's not like a one size fits all approach to testing or treatment. We really try to hone in on what your specific needs would be by interviewing you and asking you questions about kind of how you feel this is impacting, and making sure that the goals that we would have for therapy are really specific to your day-to-day needs. So based on your work and your day-to-day functions in the house or community obligations and things like that. So it's very personalized to kind of what your needs would be. And kind of going into that, then our treatment would kind of look at direct tasks that kind of stimulate some of those areas of difficulty, talking about ways to change your approach to a task, maybe compensating for some of the changes that you're undergoing with some of the ways that your brain may not be organizing things in the same way as it was before. And that can look different for every person. We use a lot of like external supports for that too.
And we like to kind of, the way that Katie was speaking about caregiver involvement and home programming and carryover, we like to set patients up based on their level of tech, using tech with iPad and smartphone applications, and different applications that they can practice in the home or use for just daily stimulation, and giving them those options of just ways that they can integrate just a therapeutic approach into their everyday life.
And I think there's always a big focus on like physical fitness, and that is so important for, you know, just quality of life and general health. But there's more and more coming out about cognitive fitness and how important that component is to a good quality of life, and, you know, maintaining your ability to do the stuff that you want to do without having to put a lot of extra effort into it. So we focus a lot on kind of things that we can teach you to do long term to really not only improve maybe areas that you're noticing deficits, but also to just maintain any gains that you would make in therapy too, so that you don't feel like you backslide or have any, trouble beyond when you're done with our kind of formal treatment. So, any questions about that?
Yeah, thank you. It's great.
And then the last area that we go into is voice. And so that can impact many patients that have gone through treatment for a variety of different diagnoses related to cancer because of impacts on breath support and maintaining good breath support for good voicing. And so we will go into some different techniques for adequate breath support for speech, and pulling in some vocal hygiene suggestions. Vocal hygiene being how you keep those vocal cords moist, and how you, again, pulling in the information about the xerostomia in addition, to optimize good voicing.
Yeah, and avoiding things that aren't good for your voice. Like, depending on certain job titles, there are people who have to use their voice for a living. And sometimes, when you're in the trenches and you're going through things and you're fatigued, you may start to use your voice in a way that's really not helpful or good for your voice long term. So that's another component of vocal hygiene as well.
And then if that is the case, if you're a teacher or if you're somebody that presents all day long, and you're starting to notice some vocal fatigue, there are some adaptive equipment pieces we can offer, suggestions to utilize to help with the utilization of your voice for longer periods of time if that's something that your vocation requires.
And we often will kind of collaborate with the other members of your medical team, including, your physician, because there are occasionally times where we'll want to kind of get a better look at your vocal cords and know a little bit more about kind of what we're treating and maybe why we're hearing some of these changes. So sometimes that means us referring out for like an ear, nose, and throat doctor, or doing something called a scope, where we really get to look at the vocal cords themselves and gives us some additional information about kind of what our treatment approach will be.
And when we're looking at some of this, if a patient is also working with occupational therapy or also working with physical therapy, we'll really kind of to collaborate as a team for optimizing those components for breath support, endurance, all of those things together, so that we can give them a collaborative approach to regaining that good breath support for all of those things, without making it so difficult for them to follow through with.
Yeah, I think that's the biggest thing, is we as a rehab team work really well together to kind of collaborate and give patients sort of that best mix of all of our advice and interventions as they need them. And we also really like to be able to be a collaborative part of the rest of the wellness center and the team that's over there, and everything that we can offer from a holistic approach. So we're grateful to be included.
Oh, well, thank you all. We're checking the chat to see if there's any questions. So if anyone does have any questions, please speak up, or feel free to enter something into the chat. Was that your last slide before I say more?
Yep.
Okay. Well, Melissa and Angela and Katie, I just can't thank you enough. This was really, really informative. And Melissa and Angela, you should go on the road, because the way you kind of tag team, like you go from the small second of the end of a sentence, and then someone else's beautiful voice picks up and it just bounces back like a tennis court. It's beautiful. So please go on the road with that. And the cognitive function and the huge impact that has on someone's quality of life, that we just don't know. We struggle along day in and day out thinking, it's me, I've just got to work harder, I've just got to do this and everything. And to know that there's some real assessments that can give you concrete information and then specifics about what you could work on, again, it's just invaluable. So many people are suffering with, yes, this chemo brain or brain fog, or just the overwhelm from their diagnosis and their treatment that is making stress overwhelming and coping nearly impossible. So to know that all of this can come together And exactly your last message, the collaborative approach within rehabilitation services is incredible. And you helped, me realize that even more, knowing that you'll talk to occupational will talk to physical therapy, and back and forth. And, if you're in one of those therapies and they recognize something, they'll refer you over.
Absolutely.
So it's great. And when we were talking with Christine from physical therapy, patients had questions about the referral process. And it is relatively easy. Your provider should be able to hear you and set you up. We're just simply doing a referral. As a nurse practitioner, I can make referrals to rehabilitation services. So if anyone's having a problem getting a hold of their provider and getting a referral, then you can just give Lindsay a call and she can connect you with me so that we can get you a referral to get an assessment with rehabilitation services. And insurance is pretty good about a lot of support around that and getting,
Absolutely.
coverage. So Christine was helpful with that as well. And for each of your departments, you feel that that's the case too?
Yeah.
It's just an evaluation, right?
Yeah, I think that's the other thing is like, I mean, I know sometimes patients that are going through all of this do sometimes have just appointment fatigue because you're constantly seeing so many different people. And
We need
so
a
I think
slide
sometimes
on
that's
appointment
a hurdle
fatigue.
or a barrier. And we really do try to like optimize. If you're coming in, we recognize that and we really try to optimize our time with you to make sure that it's really beneficial and it's worth your while. But yes, we work, our front desk staff is also really good about kind of running insurance checks and assisting us to make sure that, we're also providing a service that's going to be covered. So we have a team that kind of helps us with that as well.
Yeah, that's great. Well, I don't see any questions, but again, we recorded this, so we know many people will be watching it when it's maybe a better time for them, or, when they're able to multitask a little better, listen to it and do other things, which I think all of us do with these types of recordings and social media nowadays. But we're really excited for it to end and for next year to have everything live for our Survivorship Week. So. Again, team, thank you. It's really exciting. And I will say again, the collaborative approach, and not just between all of you, but the idea that you and the Wellness Center and the radiation oncology, the medical oncology, the breast center, all 3 floors, no, 4 floors, because it's the ground through the first, 3rd floor of the Cancer Institute, really make it convenient, as difficult as it all is, really make it convenient for patients to get all of their care and support within one building.
Definitely.
All
Absolutely.
right, team, thank you very much again. I really enjoyed
Thank
this.
Thank you.
Thank you. All right, have a great day.
You
Yeah,
too.
too.
Bye, Katie. Bye-bye.